nurse today, and I'll be performing a head-to-toe assessment. If you could step on the scale, we're going to start with your height and weight. At this time, I will get vital signs as well. All right, you can come on down. I'll let you go because it's a long way. You come on down and sit down on the bed. I'll be assessing my patient's gait as she walks and sit down on the bed. May I ask what your name is?
Christine Swartz,
Can you tell me what day is it?
March 6th,
And where are you?
the doctor's office.
All right, my patient is alert for unit times 3. I'll start the head-to-toe assessment with the hair. I will be assessing the skin and performing range of motion throughout this exam. So I'm just looking at the hair redistribution. I'm displacing the hair so that I can see the scalp for any lesions, lumps, or bumps. Next, I want to move down and I want to palpate the fontanelle sinuses, the ethmoid sinuses, and the maxillary sinuses. Then I want to look at the eyes. I know that the pupils are equal, they are round, they are reactive to light. If you could follow the tip of my pen for me. And here I'm assessing the extraocular movement. This is cranial nerves 3, 4, and 6. They are functioning. That's the oculomotor, trochlear, and the abducing cranial nerves. I didn't.
Sensory or motor?
Oh, I didn't say that when I did it.
You didn't?
She said we need to.
I didn't have to, and I had Hussein, and that's the big one. Okay. So then I want to assess the external ear. I see that the eyes do line up with the ears. I want to look at the outside of the ear, searching for any lumps or bumps or any type of lesions on the ear. I want to move down. Can you make a happy face for me? Sad face. And this here is assessing the facial nerve, which is cranial nerve number 7. I could also put salt or sugar on the anterior 2/3 of the tongue. Can you clench your jaws for me? And can you move your jaw in and out and side to side? This is assessing the cranial nerve number 5, which is the trigeminal. I want to move down to the nose. If you could occlude one side and blow out every for me. And occlude the other side and blow out. And here I'm assessing the olfactory cranial nerve. It's checking patency of the nose. That's all it is.
Olfactory is number 1.
It's just motor. Okay, and then I move down.
Olfactory is sensory. I'll just state it in the video.
Yeah, I could also have my patient close her eyes and occlude one side of the nostril and verify 2 different smells. I then move down to the mouth. If you could just help me say for me. And then I got your little tongue stick and I got my little pen right. So I hold the tongue down. And here I'm assessing that the uvula stays midline, that the soft palate does rise and fall. I'm also assessing the oral mucosa, which is the inside of the mouth. If you could stick your tongue out, lift it up and down, side to side. And here I'm verifying cranial nerve number 12, which is the hypoglossal cranial nerve. That's 12. I also verified the glossopharyngeal by assessing my patient when I asked her her name, where she was, and what day it was. And if you could swallow for me. And here I was checking to see that the trachea did stay midline, and that's also glossopharyngeal. And then you also got 10 in here. This is where it gets a little bit complicated because you got 3 in the mouth. 10 is the soft palate rising and falling, and the uvula staying midline. Next, I want to palpate the lymph nodes. I got the temporal, the preauricular, the postauricular, the occipital. I got the cervical chain. This is what I did. Now, I know y'all may have assessed them differently. This is what I did when I did. I just did the cervical chain down, and then I got the supraclavicular. That's how the lymph nodes fall. And then I want to palpate the carotid, check in their symmetry, and then I would walk around. I can't walk around so that I can assess the thyroid. If you swallow for me, making sure that it stays midline when it rises and falls, and it does. Then I moved down. I went to the arms instead of the chest. So I know that the arms are symmetric. I want to look at the nails. I want to assess capillary refill. If the nails are painted, flip the hand over and check capillary refill on the tips of the finger. I also want to palpate the brachial artery and the radial on both arms, checking for symmetry. And the radial. That's it for the arm. Well, I got the reflexes. I got the trigeminal, which is right here, which is an inch above the elbow. I got the brachial, which is right here. And then an inch to 2 inches above the wrist, which is about right here for the brachioradialis. And then I want you to squeeze my fingers, just testing the muscle strength. And then I want to move to the chest. And here I'm just looking at it, I'm watching it fall. I'm checking the AP diameter that it is 1 to 2, and it is. And then I'm going to go around to the respiratory. I want to check the lungs. And I'm just going to displace her hair here. I'm going to send it around to you. I'm going to check tactile firmness, so if you could say 99 each time I touch you.
99. 99.
And here you're assessing the vibrations,
99. 99.
which should become fainter as you go down. Next, you want to check respiratory excursion. You got C7 right at the bend of the neck. You got T1, T2, T3, T4, T5, T6, T7, T8, T9, and T10. You can also go down to 12 in your much larger patients, but T10 and T12 is where you want to go. You just want to pitch in a little bit of the skin, and if you breathe in and out through your mouth for me, and your hands should come back symmetrically in the same pattern. You also want to auscultate breath sounds. This is the pattern. Each time I touch you with the stethoscope, if you can breathe in and out through your mouth for me. And then down. And once more. And here, whatever you do to the front, you also want to do, whatever you do to the back, you also want to do in the front. So if you could just kind of light it up. And next you want to go back to assessing the chest area here. You want to note the rise and fall, see if you see any visible palpitations. You want to, this is the counting down the vertebra. You got the suprasternal notch. You got 1, 2, well, suprasternal notch, and then the angle of Lewis, just about right here. And your fingers should slide into intercostal space too. Right here is the site for the aortic valve, aortic valve, vascular sound. And you go straight across. You have the pulmonic vascular sound. Go down to 3. Intercostal space 3, you got Erb's point. Intercostal space 4 is the tricuspid valve, vascular sound, or 5. You go down to 5 and mid-clavicular line, which will be about right here, and you listen for the apical pulse, or you can listen for a whole minute for the PMI. Next, you want to auscultate this pattern, this same pattern. And then before you auscultate, I skipped one. You want to palpate for lifts and heaves in the same pattern. And then you auscultate. Then you want to drape that portion of your patient and move down to the abdomen, so only this needs to be visible from underneath the breast and just above the perineum. Here you want to you want to inspect the abdomen for the contour, the shape, and any hernias that may be visible. You want to auscultate before you palpate, because if you palpate first, you'll disturb the bowel sound. So you put your stethoscope on, and you just, whatever pattern you use, just 2 to 3 spaces in each quadrant.
You're auscultating first.
You're auscultating, you're inspecting, auscultating. And at this time, you want to flip it over to the bell so you can listen for the vascular sounds. You want to go an inch below and an inch over for the iliac sound. You want to go an inch from the umbilicus up and over for the renal. This is the right renal sound. Got the left renal, then the left iliac. You also want to listen for the aortic, which is just about a half an inch from the left renal. Then you want to palpate in that same pattern, just lightly. And then you're done with the abdomen. You want to redrape this portion and expose the periaorta, which is about right here. Before you start asking all your questions, you want to check for the distended bladder with a deep palpation. If you feel grapefruit, the bladder is distended. If not, you don't have a distended bladder. Okay, can you tell me when your last bowel movement was?
This morning. You asked.
And the
I'm
last,
nervous today.
the first day of your last menstrual period.
March 1st.
Okay? And how frequently do you go to the bathroom? You go maybe at night and in the morning?
All day.
Okay, that's good. And then here you just want to inspect the periarea. You're looking for hair distribution, the general appearance, and then for any lesions of any kind in this area. Then you're done with the periarea. But on a man, you want to ask if his testes were descended and if you could see or ask if, he had a circumcision. Then you're done. You want to drape that portion, and then you want to move down to the lower extremities. You want to palpate the femoral arteries, the popliteal on both. Make sure they're not wearing shoes or socks. Palpate the dorsalis pedis and the posterior tibia. Then on the legs, you just want to look at hair distribution and edema. And then you can sit up for me. You want to test the muscle strength of the legs if you could. She has good muscle strength here. And you want to check the patellar reflex, which is about right here. The Achilles, which is just behind the heel. And then the Babinski. Now, during my assessment, I forgot to check cranial nerve 10.
11.
11, sorry. For a spinal assessment, if you try to raise your shoulders. All right, and if you try to turn your cheek.
You didn't forget to do that either.
You did. I forgot or I did? You did. Okay, I thought I forgot. I remembered at the end. So I did, not on my assessment, but I did forget during this one. But you want to check both of those for the spinal accessory. And I think I got everything.
Skin turgor.
Skin target on the chest. You just want to pinch up a little piece and let it go. If it goes back to normal within 3 seconds, you would document that as skin turgor less than 3 seconds.
And you're inspecting the skin throughout.
Yeah, I said that again.
Okay.
And cranial nerve number 8, it says test with a whisper.
Oh yeah, the acoustic. And you just repeat what I say.
I think you have to be behind the patient for that.
Okay.
Yes.
Well, no, because I was in front of you.
You're supposed to be behind, I think.
Do you say you can do the rind and the liver? Like you state that?
Which one's Ryan and which one's Weber?
Rind is where you take the, whatever you call that thing, you hit it, and you put it on the mastoid. And Weber is where you
On
hit
top.
it, and you put it in the center. You gotta make sure it touches the skin.
And it should be AC is greater than BC.
Yes.
Is that everything?
I got the extended bite this time.
Sissy, you did the nerve.